A lot of us who are 50 plus years old are going to deal with lower back pain. I have many different mobility exercises that I often do for myself and my clients to quickly address that and to alleviate, if not fix, some of the symptoms of chronic lower back pain. I will show you two, and these exercises fall into the category of mobility exercises. I often do them as my warm-up. My clients do too, and I'm going to show you the first one's called a hip crossover mobility exercise. We're going to address the tight hips that are often, I'll use the word stuck to your lumbar spine, your lower back. Remember, your lower back does not need much mobility. However, the joint below it, the hips, need a lot of mobility. And oftentimes, a lot of us, as we get older, we get really stiff in our hips. We lose mobility in our hips, and our body will seek that lost mobility from our lumbar spine. You don't want to rotate too much from your lumbar spine. You're asking for trouble, especially with issues like stenosis, lumbar spine disc herniation. All those things can be aggravated pretty quickly with a lack of mobility in the hips. So really quick, I'll show you the first one. It's called the hip crossover. I will give you one set of 10 reps, which is what I do for myself and my clients do also. You're gonna lay on your back. Really simple exercise. I like to do it first with your body in this position. Your arms are out to the side. Your palms are down on the floor. You're gonna basically turn your head to the left as you rotate your hips to the right. My right outer knee just touched the floor. That's one. Just short pause in the middle. Turn your head to the right, rotate to the left. That's one. Now let's show you what tempo would look like. Two. I'm already getting some back cracks and back pops. Three. 4. 5. Great way to start the day too. 5. 6. 7. 8. Give you 2 more reps. 9. 10. So that was the hip crossover stretch, addressing the tight hips. A second one that I love, clients love too, is called a sideline thoracic spine rotation. We're going to address the tight thoracic spine area, which is probably the most mobile part of your spine, and we lose it because as we get older, we get that hunchback posture, the tortoise shell, that rounded middle back issue, and when we get stiff and inflexible in the thoracic spine, which is also called the T-spine, once again, your body will seek that lost mobility from the thoracic spine. It will seek it from the lumbar spine. And again, this part of your back, of your spine, does not need much mobility. So let's address the tight middle portion of your back, the thoracic spine. All you would need is a pillow, a yoga block, a foam roller to place under your head to put your spine in optimum alignment. I'll show you a quick set of 10 reps, only on my right side, but you would do both sides. So, fetal position, hips 90 degrees, knees 90 degrees. Take your bottom hand, this is really important. Take your bottom hand, place it on top of your, in this case, your right knee. Pull that knee down as hard as you can. Right arm's out in front of you, palms down. Now you're gonna rotate. Your eyes follow your hand back as far as you can. 1. The back of my right hand just touched the floor. This is your tempo. 2. Another back pop. This feels great. 3. Giving you 10 reps. 4. 5. 6. 7. 8. 9. Woo, that feels good. 10. Then you would roll over and do 10 more on the other side. I want to point out, this is really important. If your bottom hand's not pulling your knees down, if you're not doing this, what's going to happen is this. Watch my right knee. It's going to come off your left knee. You're going to rotate from your hips instead of that middle portion of your spine. So really lock out the hips with your bottom hand on top of your knees and pull your knees down to really maximize the rotation coming from that middle lower area of your spine called the thoracic spine. So there you have it. Just showed you 2 wonderful mobility exercises that you can do as often as you like if you're feeling really stiff in the hips. I typically will include this with 8 exercises total and call it the mobility warm-up for myself and my clients. It takes about 5 or 10 minutes, but for those of you right now who are really struggling with lower back pain, these 2 exercises can be done first thing in the morning throughout the day. Do it with consistency, and I bet you within about a week you would feel some relief from your lower back pain. There you have it. If you have any questions, please reach out to me. I appreciate you. Thanks.